and welcome to the recording of Mastering the POCT Stakeholder Personas for Project Success webinar. Our expert speaker, Carole Gough, Senior Medical Scientist POCT and founder of Labwise Academy, will enhance your understanding of how to navigate and influence different stakeholder groups. For further free content, please visit www.sbk-healthcare.co.uk. Thank you, and I hope that you find this webinar is educational and enjoyable.
Well, hello everyone. It's great to see so many point of care managers and point of care coordinators on there here today, because that's who really this is for. So today we're going to be looking at stakeholder personas for point of care success. My name's Carole Gough, and I work as a change manager at the moment in the HSE, but I have spent a lot of years working as a senior medical scientist, and I've also worked in diagnostic sales, implementation and training. So today we're going to look at how to get your projects approved by looking at the point of care personas. So I founded Labwise Academy just to use that experience that I have and to put it into a framework really to expedite the way that you engage stakeholders in point of care projects. So I just want you to imagine if you're walking into your next committee meeting and you know exactly how to speak to the finance person, what the IT manager cares about, and how to get quality on board. So watching your projects get approved more quickly in weeks instead of months, or perhaps even months instead of years. So it's just really trying to help to move the needle on that, and developing great partnerships with vendors as well, and projects getting approved, but not just getting approved, but implemented. I think we've all seen sometimes, you know, a device could even be bought and it could be in a box on a shelf, and it mightn't just get off the ground. So that's what we're going to look at today. So it's a problem we all face, and we know that point of care, it can be challenging. There's a lot of barriers there. There's a lot of challenges. So I just want to ask you to put in the chat, is there a project that you've ever championed or put forward and it's been rejected or delayed, and you knew that actually the science was really solid and the clinical need was clear? I mean, you might have even been asked by a consultant or a doctor or the laboratory manager to implement it, and you knew exactly what the solution was, but perhaps then it still didn't happen. So just want you to put like yes or no in the chat if that's ever happened to you, and also why do you think it mightn't have happened? So just maybe one or two words. Was it budgets? Was it resources? Was it resistant stakeholders? You know, what were the type of problems that you were experiencing? Yeah, so I can see there's a lot of people have said yes to that. Lack of funding. Yeah, the budgets and the resources to implement. Yeah, well, I did. I put forward a survey, put it together through Labwise Academy, and actually the Academy of Clinical Science and Laboratory Medicine distributed it. That's the equivalent of the IBMS here in Ireland, where I'm based. And what came back was pretty clear. So really we were looking at the pain points for point of care coordinators, and two clear ones did come back, and that was connectivity and interoperability, and the other one was stakeholder engagement. So that's what we're going to look a bit further into today. So by the end of this session, then we're going to look at the solution. We're going to look at 4 critical stakeholder types. Now, we're using these 4 stakeholders, but actually, there's a lot more stakeholders that we could look at. We're just picking these 4 today. We're going to look at what each one actually cares about, and how to communicate to get a yes instead of a no, looking at phrases that open the doors instead of close them. So we're just looking to move the needle on that. So what is a stakeholder persona? Well, it's a detailed profile of a decision maker. So it helps us, I suppose, compartmentalize the stakeholders, and then we can look at their role and responsibilities and what actually motivates them. What do they care about? What concerns them? So what keeps them up at night? So that's what we're going to tap into when we're looking at stakeholder personas. So how do they prefer to communicate, and what language resonates for them? So I suppose you could think of it as speaking French to French speakers rather than shouting English louder. I think we've all done that. So I think what I'm saying here is that we want to speak their language instead of just maybe putting forward what we care about only, and trying to push that message through. So the thing we're going to focus on today with the personas is that really we speak different languages, and that's what by the end of this we're going to maybe have more of an insight into what sort of language we can use when we're speaking to these different stakeholders that we deal with. So we're medical scientists, so we talk about sensitivity, specificity, turnaround times, correlations. So when we use those words, there's a lot behind it. So, for example, a correlation, we'd be thinking about comparing samples and, doing a validation. And so when we say those words, there's a lot of meaning behind it for us. To other people, it might mean different things. Finance, that they talk about a return on investment, maybe not so much in the public sector, but it definitely in the private sector, they're going to be looking for a return on investment. But really, they're going to be talking about money. They're the senior managers in the organization. But they're not just going to be looking at money, they're going to be looking at risk as well. They're going to be looking at enterprise risk, not just clinical risk. They're going to be looking at the risk to the organization, so they do care about that as well. They're going to be looking at strategy, so what are their long-term goals? And we're going to be looking a bit deeper into this as we go through each of them. We're going to look at IT technical people, personas. We're mainly going to focus on IT today. So what type of language do they use? Well, they use things like words like integration, interoperability. They look at security protocols. They're going to be looking at servers, infrastructure, specifications. That's the language that they speak. And then procurement, very important when we're looking at procuring our devices and connectivity in our solutions. They're going to look at the total cost of ownership. So they're going to look at upfront costs and other costs. And they're going to look at vendor management. They're interested in contracts and doing due diligence around the procurement of devices. So you can see here clearly it's the same project and it's 4 different languages. And I should say it doesn't have to be on a project. It could be something smaller, so you can scale this up or scale it down. You could be trying to engage a person for training, for instance, in their department. So what I would say is I know that you're all under pressure and that you don't have that many resources. And that a lot of you do work on your own and you don't have very big departments. So what I would say is to start where you are and use what you have and do what you can. And that's what today's about. And I'm actually going to give you a template at the end of this that you can use and start to work on it tomorrow. If I needed any indication that this was really important, is that I went to a conference recently, and one of the people that was talking, he was a professor, he was a GP, but he actually set up a community frailty hub where frail people could be discharged from hospital earlier, and he got the discharge down from 9 days to 1 day. And point of care was part of that. And this is one of the things that he said as well. And it's something I'd heard before, and it has helped me before. So I hope today, yeah, you could use the template and maybe make a difference, even without having to procure extra resources currently. So the 4 people we're going to talk about today, we're going to talk about a clinical stakeholder, we're going to talk about an administrative partner or a senior manager, we're going to talk about a technical person, IT, and we're going to look at procurement as well. So the clinical stakeholder, well, we all know these. So what do they care about? Well, who are they first? They're consultants, they're doctors, they're nurses, they're clinical practitioners, and they're using your results to make patient decisions. So that's what's important to them. So what drives them? Well, they're looking at patient outcomes, and it's all coming back to, well, how does this help my patient? They're also looking at workflow efficiency. So they're looking at a clinical workflow from that device to get their results. They're looking at, if this device comes into my department, how is it going to fit into the department? How is it going to work within the department? Also, if you're giving them any information, they're going to be looking at looking for peer-reviewed results, peer-reviewed information, peer-reviewed data. And you can often get this from vendors, or you can, look it up yourself. But yeah, I often find like the vendors have a lot of really good case studies. They're looking at clinical accuracy. Well, that's non-negotiable. And I think we've all come across that, where we have to do a correlation to the laboratory or a correlation to the gold standard for them. They're probably not interested in a deep dive into the technical specs. They might want to know, does it integrate with the applications that we have locally within their department or within the hospital? So as we know, these people are pretty busy. They have their patients, so they're not always in an office waiting for a call. So it is important, I suppose, to keep it brief, to know what your outcome is going to be with them. They want real patient case studies, as I say, peer-reviewed information, which you can get. And the conversation with them might look like with an ED physician using procalcitonin, for example. We could say that it reduces sepsis mortality by 18% because they started using antibiotics 3 hours earlier. It reduced the length of stay, and it rules out sepsis. So that's the type of information that they would like to hear. So the administrative partner, well, who are they? These are the senior managers. They're people like finance directors, budget holders, but they could also be your quality managers, your regulatory affairs managers, your practice nurse development managers, senior clinical nurse managers, senior trainers. But today we're going to talk about the finance director and the budget holder. So what drives them? Well, as I say, they look at the money aspect of the proposal. That has to make sense, but they also care about risk management. So they care about protecting the organisation. That's enterprise risk management. And in one of my courses, actually, risk management, I go through using risk management as a lever to get projects approved, because risk always comes up around the table with senior managers. It's not something that they can ignore. So if they are aware that there are risks within the organisation, they will have to address that. So, you know, risk isn't a bad thing. It's a great thing if you have a system in place, and if you're able to pick up risks and address them. And if you can address those for senior managers, well, they're going to be happy about that. Same with compliance requirements as well. Strategic alignment, so they're going to be looking at the bigger goals, the longer term goals for the organisation. So if your proposal fits in with that, then that's going to be really good for them. They're going to appreciate that. They're going to understand that. For example, you know, we had a time when we were rolling out Wi-Fi across the hospital. That's going to be beneficial for implementing your devices and connecting them, and you can link in with that strategy within the organisation. Things like getting barcodes on wristbands and things like that. Well, if your devices have barcode readers, then you're going to be able to use that and link in with that, and the senior managers will appreciate that because it's future-proofing things for them. It's also reducing risk by having manual, you know, a manual system in place. And what they would really want to know as well is the benefits of over the current service and why. So it's important to point those things out to them. They probably don't care about much getting down into the intricacies of the technology or the IT specs or the intricacies of the proposal. So I've written this up here because I would probably forget his title and everything, where he is. But again, this person, Jack Wagstaff, he's an executive director of strategic commissioning in the NHS Surrey Heartlands ICB. And he's looking at transforming commissioning through rapid diagnostics. But what I took from Jack, he was speaking at a conference, is that is that when people come in and give a presentation to him, he says they do give great presentations about the solution, but on a lot of occasions at the end of the presentation, he doesn't know the benefit of the solution, of the proposal. So that's, you know, I thought that was quite telling, and it actually feeds into what we're talking about today. So it would be important to know what someone like him would need to know, what sort of information they'd be interested in knowing, as he's a senior buyer, senior commissioning manager. So the senior managers, well, probably by the time you get to a senior manager, you might be looking at approval. I mean, it'd be nice to engage them before you get to that point, but by that time, you've probably got your risk mitigation plans. You've probably risk managed your service, or, you know, risk assessed your service. You've probably got all your quotes together, your finances, you know, the benefits of the proposal and why you're doing it. You've got all the operation considerations together and the benefits. So that's something that you can put into an executive summary, and it's going to highlight all those points, not just for the finance manager, but for all the people that are going to be in that approval meeting. So it's going to hit all the points for them. And we'll see at the end how you can bring all of that together and you know, think about the ears that are listening to your proposal. So as I said, they don't really want to get down into the nitty-gritty. They don't want a vague, it's better term. They, you know, they need proof. They need a clear outcome. They need a clear benefit. So the administrative partner, what they want to hear, well, obviously this is a very busy slide. I've kind of just read it, but this is an actual meeting that I was in where we had to approve a project, and it was during COVID. We were actually sitting in a church in a hospital because we all had to be spread out. But in that meeting, there was the laboratory manager, the finance person, the practice nurse development manager, the infection prevention control. So all the senior managers in the hospital, quality and risk and everything. So you could say something like this to them, because this would speak to nearly everyone in that audience. So this system pays for itself in 18 months through reduced central lab send out. So it saves this amount of money while maintaining the INAB compliance and reducing liability exposure from delayed results. The upgrade in connectivity is going to give us a positive patient identification. It's going to reduce errors. It's going to integrate with our existing electronic health record and link into local systems. And it will put us in a place to integrate with other third-party and community applications in the future. So it's future-proofing. I've costed it out, and these are our current costs, and these are our future projected costs. And for this much more, which is not much more, we get a massive upgrade in capability and future-proofing. So it's important to remember, like, you do have a current cost. So it's not them laying out the money from the ground up. There are current spends there already. The benefit will be that there'll be more analyzers for initial requests, and we had considerable risk around not having enough of these analyzers as laid out in the risk assessment. So that's an actual thing that happened. We got some complaints about analyzers down, but it wasn't actually the analyzers, it was pre-analytics. It was blood gas analyzers. We didn't have enough analyzers, and samples were clodding up on the journey to the analyzer. So we did a whole risk assessment, and we were able to get procurement for more analyzers based on that. So I'd say that money talks and mitigating risk talks. And as I said, we can use risk as a lever. And I would always look at the current costs versus the future costs, and remember to put in the benefits in there. So IT professionals, we're going to look at IT. I spent a long time on the senior managers there. So IT, so what drives them? Well, the primary motivation is that, system integration, interoperability, everything connects seamlessly. They're very focused on their own thing. They're not particularly focused on the bigger picture, I suppose. They're looking at technical specs. They want concrete details. They want integration protocols, connectivity protocols. They're looking at servers and infrastructure as well. They're looking at uptime and reliability of the applications. And more and more now, of course, they're looking at cybersecurity, and they're looking at data integrity. They are going to use words like, or acronyms like HL7, POCT 1A, the integration protocols. They're going to be looking at FHIR, so interoperability protocols, and CISO. SNOMED looks at all the clinical nomenclature for healthcare. So they're the types of things that they'll be looking at. They're not going to care about clinical benefits, and they're not going to care about cost savings. So what I would say with IT is engage them early. Do look at their process. Where I was working, we had to put forward a project mandate, and we had to put everything into that. I actually use that as an opportunity, and I would use these things as opportunities. I wrote a 3-phase mandate about getting our devices connected, and having docking stations, and then connecting it to middleware, and then connecting it interoperable to other systems within the hospital. So I kind of gave it to them in bite-sized pieces. And again, I use risk with this. So I use the ISO 15189 standard. We'd already risk assessed all the services, so we knew where the points were along the workflows where not having the correct IT and integration was problematic. So again, just using risk as a lever. So they like our architecture diagrams. So a good thing is to map out all the IT. That's essential to know that. The earlier the better. They need specifications. Obviously, you get those from the vendor of the application. Infrastructure, the VMs that you need. You might need cabling, you might need patching, you might even need shelves. You might even need shelves to put the devices on, but that can be a stumbling block because that can be a separate procurement process and that can hold up your IT getting implemented. So again, engage early, engage with facilities or whoever looks at that and procurement. You don't have to know everything about IT. You can often coordinate with the vendor and IT person. So they probably don't want you to say, well, don't worry, it integrates with everything. They want specifics. They want you, like it uses HL7. We need an ADT feed. It integrates with X system, whatever that is. We've done a security audit. And we've looked at the integration protocol. So when can we pencil in time with your team? With all of the digital transformation going on at the moment. They are really, really busy. So it's important to get a slot and a timeline with them for your project. With connectivity and risk management now, it's and going to decentralized testing. It's even more important for them to have governance over all of this. So last but not least, procurement. So we're just looking at procurement officers. I would say that most people, their procurement officers are quite accessible to them if they have procured anything. But at the same time, they can be the senior managers as well, and they will sit round the table with the senior managers. So what drives them? Well, the primary motivation is value for money. Even if you've got your quotes, they're going to go, procurement's going to go to the vendor and they're probably going to negotiate even more with them. I mean, that's their job. They're going to put forward due diligence. So they're going to comply with the policies of the organization, but they're also going to comply with national and international standards as well for procurement. So below a certain amount, above a certain amount, do you have to go out to tender? Do you not have to go out to tender? They're also going to link in with those senior managers on the strategy of the organization. So they're probably going to ask the lab manager, is this future proofing? They're going to ask the finance manager, does this fit in? They're going to ask the senior practice development nurse, does this fit into the long-term strategy? They're going to be looking at life cycle management, as we know, life cycle of analyzers and connectivity. They're going to be making the vendors accountable, so looking at contracts and enforceable terms and support from the vendor. Process compliance, as I mentioned, and they're going to be looking at things like, how does this make a difference overall? So as I was saying earlier, the benefits, what are the benefits at a high level by implementing this? So this slide goes a little bit too much out to the edges, but just to consider that point of care, it's not a standalone anymore. It's a real hub. It's a real part of community, community settings and hospitals. And really, we need to be front and center in these conversations. Point care scientists, they have really pivotal roles, as you know, between their organisation and the vendors, between their organisation and community, and between their organisation and third-party providers. And we really do have the technical expertise for this, and I think people need us in those conversations, but sometimes they may not know that we're there, or they may not understand what we do. So I think, stakeholder engagement does facilitate us getting in front of the right people and being part of those conversations. So, I mean, stakeholder skills, I don't think it's like they're nice to have anymore. I think it's something that we really need because we're working cross-discipline, and really we're irreplaceable by any technology or AI. So bringing everything together that we talked about, just a case here as an example that we're implementing a rapid flu RSV testing in an ED department. Really what I talked about earlier, imagining yourself in that room with all of these different people in it. So what do they actually hear? Well, the consultant, the doctor might hear that it reduces elderly patient mortality to 0 through rapid antiviral administration. And I have actually heard a real world example of that in a nursing home, where they really reduce the deaths by having this point of care device. The administrative partner heard, well, it's 127k in annual savings through reduced admissions, 23% faster ED throughput. So the administrative partner, they don't just care about money, they care about other things like patient length of stay, upgrades in connectivity. They do understand those headlines. Technical collaborator, they're hearing, well, it's got HL7, it's going to integrate with our electronic health record. There's no manual entry. We're going to interface it to our current systems. Sorry. Procurement, it's got an 18 months total cost of ownership. So that's looking at what's the total cost of ownership. It's looking at consumables. It's looking at maintenance and staff training. And that we can make a saving versus what we're doing now. Just remembering that current versus future cost. And it's approved in 6 weeks instead of a 6 months delay. Yeah, I know that's theoretical, but we're just trying to move the needle on this, and hopefully we can. So just some of the mistakes, just using the presentation, same presentation for everyone, but we won't do that now. I think maybe after today, when you can look at the different personas. I'm going to move on to this slide now so how do we use this framework? And this is to go with the template as well. So identify who's in the room or who needs to be for your conversation. As I say, it could be one person, it could be several people. Research what each persona cares about in your context. Translate your project into their language. So just really listen to what they care about. I mean, even if you haven't got a project, you can start talking to people tomorrow. You can start getting on committees and other committees in the hospital and engaging with those stakeholders for shared outcomes. Tailor your communication for each stakeholder and coordinate and ensure the messages align, but speak to each person in your audience. So there is on labwise.ie, there is a download that you can get with the 4 personas on it. Some people might have downloaded it already, but it just does a quick overview here of the primary motivation, the success factor, and the communication style. But it's basically what we talked about today. So this is one of the templates, and you can download this as well. And Ingrid, I have set up a page on my website for the people that have attended the webinar today, and Ingrid is kindly going to share that after this. So this template, it's got 4 steps in it, so you can look at just going to look at the time. It's got 4 steps in it. So the first one is logging down your internal, external stakeholders. So it's by department here, but you could do it by person. We've added in the vendors here, regulatory bodies, patient representatives. It could be in the community or third party or the facilities, again, if it's in the community. Looking at their influence and interest. So you can put down the stakeholder name and their role and title, and then put down their influence on the project, 1 to 5. So are they going to gatekeep it? How important are they in the project? Are they going to stop it? Are they going to be a barrier to it? And look at their interest in it as well, which is different. Some people might have a high interest in it, but they might have quite low influence. So that's about mapping out your stakeholders, and you can put that into a priority engagement priority matrix where you can look at who's got high influence, high interest, manage those closely. Who's got high influence, low interest, you can keep them satisfied. So you can see that you wouldn't waste your time with, with the wrong people, or you can put your time into engaging people who perhaps aren't engaged but need to be engaged. And then step 4, well, you'll have your own risk identification and mitigation strategies. So you can start using that from tomorrow or from whenever you download it. So your action plan this week could be that you list every stakeholder in your current project, you identify which persona each represents, you note what you've been telling them up to now. Maybe if it's not working, you could identify the gap between your message and their language. And then next week, maybe reframe your project for each persona, just looking at it that bit differently from what we've talked about today. And schedule separate conversations with them, just get to know them. Use their language, not yours, and listen for what they actually care about, because that's going to become important when you are trying to get your projects approved. So that was my last slide. If you'd like any of this information, as I say, there's free downloads for what we've talked about today on labwise.ie. You can get the 4 stakeholder personas quick reference guide, and you can also get that stakeholder identification template. And as I say, Ingrid is going to send you on that link for those. So I just want to say thank you very much. It's great so many people signed up. I hope that what I've put forward today is of some value. If you do want to dive deeper into stakeholder engagement or into the risk management part of it, I do have 2 courses on the website for those. I'm very accessible and contactable. And I'd just like to say thank you to SPK Healthcare Events for facilitating this meeting today, or this webinar today. Thank you.
Well, thank you so much, Carole, for delivering such an interesting and insightful webinar. I hope that everyone has found it to be very useful. We do now have some time for questions and answers if anyone has any questions they would like to ask Carole. So if you could pop those in the Q&A box, that would be amazing. I do believe we've had a few come through. Maybe if we start with this one, Carole, it says, what if stakeholders don't fit these personas?
Well, they're very prescriptive. I mean, you can see that I've laid them out very clearly, each one. But that, people don't fit into boxes like that. They can in general. There's no problem with them crossing over. Different people will be interested in different things. I think the main thing is just to listen to that person. I mean, you could have a consultant and they could be really interested in IT. They could be really interested in getting everything connected. So I think it's about, and I think you do have to be a little bit creative with this. It does give you a bit of a framework, but sometimes when things aren't working, you do have to stand back and think, well, what can I do? What can I do differently here? I do think saying the benefits of things is helpful as well, having a win-win, but it's mainly listening to the different people that you're going to come across.
Amazing, that's really helpful, thank you. We have another one here. It says, how do you deal with resistant or challenging stakeholders?
Yeah, so you do get resistant stakeholders, and it can be challenging. And I've definitely come across that before. But I have tried to try and refine it as things have gone on. I have actually used resistant stakeholders, well, not used them, but if you look at it as an opportunity.
Mm.
So, for example, when I was doing some training in a hospital on the blood gas analyzers, there was no point of care person there before. So I was the point of care person who came in. So I had to do everything from the ground up. And because they knew I was there, they actually gave me 3 complaints. There were historical complaints now about the analyzer that had gone to risk. And they said the analyzer wasn't working, but it was actually the pre-analytics. But that was the scenario I described earlier, where I actually brought that forward to the risk management, the senior managers in the hospital, and we were able to procure extra analyzers. So I think with a resistant or challenging stakeholder, they are really telling you what their problem is, what they're resistant to, which is good. So do listen to that. I wouldn't necessarily go around people. They just find out what it is that is challenging to them, or what it is that is problematic. And then once you know that, then you should be able to address that. Because the thing is, I suppose with point of care, there's so many stakeholders involved. It is important for people to step back and look at the bigger picture as well. It's not about, one person.
Perfect, that's really helpful, thank you. We have one here from Kate. She says, do you have examples of how the same POCT project message should be adapted for different personas, like clinicians versus IT?
How the same project message should be adapted for different personas. Well, did I give some examples earlier on for the different kind of language that you can speak to each of the different personas? Is there something extra that you'd want to know in that respect? I would say about the courses that I have, there's about 20 templates in there. So for resistant stakeholders, you can log and track them. For stakeholders to align, for example, there's a project charter there, where when you're kicking off a project, you can actually put a project statement there. You can put what's in scope, what's out of scope, what the shared outcomes would be, and who has responsibilities for what. So it's about kind of grounding that information, and all those templates, just they lead you through it. I don't know if that answers the question to the person who asked me about.
Thank you. We have one more question here. How do you get different stakeholders to align?
Yeah, well, yeah. So that was one of the things I was saying about the project charter, because I did see this question up here. Yeah, you can just outline the project and look at the shared outcomes and let them know what you're proposing, and basically get them on the same page, so that they know that you have a shared purpose here. And then I suppose you can always talk to them individually as well. But I think when you're kicking off something, it's important to get the project aligned from the start.
That's amazing, thank you. I can't see any more questions here, unless anyone has any last minute questions they'd like to ask Carole. can't see any more. So otherwise, I would just like to thank Carole again so much for delivering this really useful webinar.